preclinical animal model, and what is the potential the pathophysiology of the endometriosis-associated pain, and then the effect of ovulation of ectopic lesion for the endometriosis associated pain. And I will also introduce one of our new preclinical animal model. So I'm using the heavily used rodent model, but I think the rodent is too small to apply the preclinical other clinical equipment, including the laparoscope. So we developed the pig endometriosis model. That's what I will introduce to you. I'm really enjoying the morning session. I think I'm surprised everybody working together and the same path. And it's also that everybody looks nearly understudied the field compared to the other disease. And we need to do a lot of things. We need to work together, not one genius people can overcome this kind of problem. So I do not need to mention about introduction of this disease, and everybody agree about it's pregnant-dependent disease, estrogen-dependent and progesterone resistance, and which involve the chronic inflammatory status and immune dysregulation, and its complicated situation develop the pain. So we think about the mechanism of endometriosis-associated pain, and I try to point out several people. It's chronic inflammatory condition, so we want to evaluate the potential therapeutic effect of their inflammatory factor. We focus on the IL-6 and the phosphorescence signaling pathway, because it's ability the immune activation and inflammatory release, and it's definitely related pain. So what we found was that we've identified the phosphorescence is abundantly activated in the human endometriosis case. Collaborating with the Dr. Aski-Pazilev's non-human primate model, after we induced the endometriosis, we also identified the phosphorescence level is gradually increased during the endometriosis progression. And we also observed the same thing in the rodent mouse model. And from this result, we think that it's a potential therapeutic target, the endometriosis. So we used the standard rodent model, it induced the endometriosis model, but we combine with the two reporter system. One is the luciferase system, bioluminescence, another one is a fluorescence. So it make the in vivo imaging system in the live animal during the endometriosis progression, and also it's easy to detect all of the small ectopic lesion. So that was our in vivo imaging data. In the live animal, we can see the number of the ectopic lesion and size of ectopic lesion. So it's we have the non-invasive imaging tool, and using this GFP technique, so we can identify the small ectopic lesion, and it's very reliable visualization and sensitive and fast. It's also the quantitative analysis. We also apply the image guide surgery, minimizing the damage for the normal tissue. And this animal model is possible to study about endometriosis-associated infertility and pain study. And this disease is a hormone-dependent disease. We check the hormone dependence of our animal model, and it showed clear that if we treated with a post-estrogenic condition, it's more ectopic lesion, and if we apply the progesterone, it's regress. And first, we want to reach very heterogeneous the disease, and also the symptom is not matched with the staging system. I think previous the data showed it's also the endometriosis related infertility. In our model, during the the stage of the endometriosis, we do not see any infertility phenotype. But at later stage, we can see the infertility phenotype. But important thing is it's implantation failure and structural defect is decreased. But even with the same genetic background, the same condition, environmental condition, there are some heterogeneous the population. Some of them also have the normal fertility. We still struggling with that happening. Signal why that kind of heterogeneous the phenotype is present. And now we think about the endometriosis-associated pain. So it's very limited the quality of their life, including walking, schooling, emotional and emotional well-being. But in the modern tumor, there are several groups that use the reflex test. That's not exactly quality of life in the mouse. So we think what is the best way to truly capture the human case? So we think about the multiplex test that is more related to human the endometriosis-associated pain. What we apply is the post-lasting test, rather than to make the that's when we give the white blood, because they want to protect the body temperature and also the preparing the pregnancy and delivery. But in the sham mice, make the nice net, but endometriosis mice, it's incomplete they're lasting. So we scale this degree of the nesting. You can see the endometriosis mice have the significant decrease of the nesting score compared to the sham mouse. Another mouse will really use the kind of than to try to hide some of the marble, the material beside of the behind of the nesting. So when we give the several marble, the sham mouse try to hide this one inside the building, and if you completely hide, we give the high score. If they do not touch the marble, we give 0 score. And it's the same thing. There's a sham mouse has the high score compared to the endometriosis screw mouse. The test is, and as you know, they want to hide the food. When we put the food pellet inside of the pipe, they diligently will and deliver from the inside to the outside. But we do the mice with endometriosis grow, it's actually also the significant decrease compared to the sham animal group. And so all of this sure maybe that's mice with endometriosis level, the endometriosis related pain. And we think about the effect of targeting of this IL-6 and phosphostaticity. And the tofacitinib is the selective inhibitor. It's FDA approved. And Dr. Schuteller would have been evaluated the impact of this tofacitinib in the rodent endometriosis model. They observed the lesion volume was significantly reduced in the treatment group, and also the tissue lesion score is improved. After this drug treatment, we apply same drug to the our model, we observe the same effect. For the endometriosis is I think the side effect is much less tolerant than the other disease, especially if it's our treatment to impair the uterine function, that is the bad. So which had topographic impact on the implantation. As we know, the staticity is played an important function, the uterine, the visualization and projection response. We see that the mice treated with topotenin become the implantation failure. And the histology data also show its implantation failure. So the topotenin reduces the endometriosis antigen, but it's impaired the implantation. It's due to the systemic defect. So we want to think about how to overcome this kind of the side effect. So routine, one of the solution is the nanoparticle. Nanoparticle is size 1 to 100 nanometer molecule, and it's used for the functional that property, and it can be the reduced off-targeting toxicity, and the advantage is mostly in it diagnostic so it can develop for the diagnostic as well as the therapeutic effect. So nanoparticle, how it works is the small molecule is diffused the whole body, but the nanoparticle case it's endometrial region, it's develop the angiogenesis, but it's some the abnormal angiogenesis. We call the enhanced permeability and retention effect. Some of leakage of angiogenesis. So the nanoparticle can access to the ectopic region, which enrich to the lesion area. And then we use the backbone as the albumin because albumin is not a harmful protein, and that we conjugate ICG for the diagnosis, and the nanocelia is the anti-inflammatory molecule. That's what we applied. So that is to show the nanoparticle structure, especially one of the important thing character is the it's effect to the macrophage shift from M1 to M2 anti-inflammatory condition, and that is the apply to the athletic use model is. And we ask the effect of this nanoparticle for the targeted drug delivery. And second one, massive diagnostic using the RA in vivo imaging, and so the therapeutic effect. So we see the first the drug delivery effect, and as you progresses, data show the it's accumulated in the ectopic region, but the utopic area it's much less than the ectopic area. And from the histological analysis, it's led spot represent the ICG nanoparticle. So we can see that it's accumulated the ectopic region, but it's difficult to detect utopic endometrial. And most importantly, when after treating did with the nanoparticle, the mouse has no harmful implantation. And the histological data also show that it's normal. And also using the photoacoustic in vivo imaging system, we can identify that it's exactly the ectopic region in the live animal after the we dissect the animal, and which the data is exactly correlated with the in vivo data. And we also ask the therapeutic effect. As you can see, the effect of the IL-6 and phosphostatin inhibitor, we also see the significantly reduction of the ectopic region. And the most important thing is a nanoparticle enriched to the ectopic area. It's less the L3-fold dose. We can see the similar effect. And we validate that effect using the expression of phosphostatin. And that data show the STAT3 activation is a major cause of the estrogen-dependent inflammation. And the theranostic, the nanocellular, or novel the anti-inflammatory nanoparticle provide a promising approach for the endometriosis treatment. And the one thing is we are focused targeting the ectopic region, and from this meeting and several the clinician and basic scientists said that the endometriosis is a systemic disease. So we ask a question, if selective ovulation of ectopic lesion is sufficient to elevate endometriosis-associated pain. So what we did was that we applied, I think, the inducible toxin ovulation system. So after we induce the endometriosis, they have the behavior defect. We remove the ectopic region and then check the pain associated behavior and the additional cells and fibrosis. So that is about the plan for the how the system is work. It's genetically engineered model. All of the cell ever express the progesterone receptor, and then if we treat it with the diphtheria toxin, all the progesterone positive cells are die. We check the effect using the quantitative analysis, and we also check the percentage of the PR positive cell after diphtheria toxin ablation. So you can see that it's completely deleted all the endometrial epithelial cell and stroma cell. And so we confirm this. We apply this technique to the animal model after endometriosis induction. And we apply the behavioral test. We see the endometriosis group show the behavior defect compared to the sham group, and the diphtheria toxic group improve some of this defect, but it's a very partial effect. And we confirm that all of the ectopic regions are ovulated after we express the experiment, and then we also confirmed all of the post PR and post statically all of the dysregulated molecule in the ectopic region. We confirm it's all gone. And then think about that. And which one of the things is that the tissue or the region that we observe in the animal model. After the ectopic lesion, we still see the severe tissue lesion. So we check that is what it and the histology. You can see the big lesion. It's all attached to the uterus and adjacent lesion. I think this is intestine. After the lesion is gone, but the tissue still have the tissue lesion. And we check the fibrosis is one of the lesion to make the tissue lesion and the induced pain. So that's why we apply the check the fibrosis. We can see the all the regions are gone, but still exists the fibrosis near the lesion. So, and we confirm the target protein, collagen, MED1, and we can see the background of the fibrosis-related protein. So it still existed near the lesion after ablation. And that's where we see, and I think I will just introduce our swine model. We published this model. There are several different the model system to study the endometriosis. I think the rodent model, I like it, and some people apply the organ. I think it depends on the which answer, the question answer we need to apply. One of the limitation of the mouse model is size. It's the body weight is the human case 2,500 fold higher than the mice. And then the important is swine model, we can apply the clinical equipment, laparoscopic system, several the imaging system. And then reintroduce the endometriosis, we can see the same concept, but if we can label the ectopic region using the particle by ex vivo labeling. Object the histology is similar to the human, and the advantage of this animal model is we can identify the fluorescence positive lesion. And in this, the generated the progesterone receptor GFP transgenic peak without any neighbor, we can see the uterine endometrium had expressed the GFP signal. And the reapply the same thing. That's the laparoscopic image in the swine model. It's very similar, but advantage is expressed the GFP, and histologically it's similar to the human. I think this model is the cohort to study the deep infiltrating endometriosis. I think I should without them, it's impossible to generate those data, and I also need to appreciate my funding source.